Welcome to our today's shows with a smiling word. And today we are going to talk about the smile and healthy diets that we should eat to keep us smiling. And today's our guest will talk about the healthy diet. So the first question I will ask them to how do you see the role of food and a healthy diet for the better health?
So, when we are talking about a healthy diet, consuming a healthy diet throughout the life course helps to prevent malnutrition and many non communicable diseases and conditions, including diabetes, heart diseases, stroke, and cancer.
Yeah,
It supports healthy pregnancy outcomes. A healthy diet not only supports the physical growth and development, but also a mental, cognitive development and helps to maintain a healthy body weight.
yeah,
New research in the fields of neuroscience and early childhood development is shedding lights on how our brains are developed and how our capacities are either nourished or thwarted based on the nutrition in the first 1,000 days. So we are talking about a woman's pregnancy till the child's second birthday. So nutrition in first 1,000 days, this is a critical window of opportunity to shape a child's development. A lot of
yeah,
emphasis on nutrition and balanced diet concept. Briefly, when we talk about a balanced diet, they should have an adequate amount of according this is basically the amount is basically individual variations depending on the activity or age or
yeah,
gender. So the viewers
yeah.
have to consult an expert nutritionist or dietitian, but generally carbohydrates in the form of whole grain, high fiber breads and cereals, fats, proteins including
Yeah,
eggs, lentils, beans, poultry, seafood, nuts, seeds, minerals and vitamins. Vitamins are very essential components of a balanced diet. And also, not to forget, roughage, the fibers as well as water content is very important. But because of the shift in dietary pattern and rapid urbanization and changing lifestyles and the availability of processed foods, there is a shift in
yeah,
the way we are eating foods, like in the form of high energy foods, fats, free sugar, and salt. So many people are forgetting the fruits and vegetable and other dietary fibers such as whole grains.
that's such a great area. And like second question, will like throw some lights on building, eating, the healthy habits for the food.
Yes, so when we talk about healthy dietary practices, the healthy dietary practices should start early in the life, and the role of parents are very essential. So we are talking about, let's say, breastfeeding, which fosters healthy growth and improves cognitive development, as we just now saw about the nutrition in the first 1,000 days of a child. And we are talking about WHO member states have agreed to reduce the global population intake of salt by 30% by 2025 and also agreed to halt the rise in diabetes and obesity in adults and adolescents as well as in childhood overweight by 2025. So the healthy diet includes fruits, vegetables, legumes, for example, lentils and beans, nuts and whole grains. Whole grains meaning unprocessed maize, millets,
Yeah,
oats, wheat, and brown rice, and at least 400 grams, that is 5 portions of fruits and vegetables per day. Less than 10% of total energy intake from free sugar. Free sugars are example,
oh,
all the sugars added to foods or drinks by the manufacturer, cook, or consumers. Less than
yeah,
30% of total energy intake from fats. Less than
yeah,
5 gram of salt, which is equivalent to 1 teaspoon per day. And the salt used should be iodized. In case of kids, we have to make sure that in the first 2 years of a child's life, optimum nutrition is very essential for growth and cognitive development and reduces the risk of being overweight or obese and developing non-communicable diseases later in life. So infants should be breastfed exclusively for the first 6 months of life and should be continuously breastfed until 2 years of age. But from 6 months of age, the breast milk should be complemented with a variety of adequate, safe, and nutrient dense foods. So, complementary diets. Sugar consumption should be reduced as well, and eating fresh fruits and raw vegetables in the form of snacks instead of sugary snacks. Less than 10% of total energy through sugars.
Yeah, that's awesome. And what's your take on the consumption of salt?
So, when we're talking about salt, most people consume sodium through salt, and high sodium intake and insufficient potassium intake contribute to high blood pressure, which increases the risk of cardiovascular heart diseases and stroke, according to many researchers. Reducing the salt intake to the recommended level of less than 5 gram per day could prevent almost 1.7 million deaths per year, which is a huge number. So, this is very essential when we reduce salt intake, how effective it can be. But people are not aware of the amount of salt they consume. So many times it comes from
Yeah,
processed food in the form of ready meals, processed meats such as bacon, ham, cheese, salty snacks, or also many foods consumed in large amounts like bread also. Sometimes they are
yeah,
added during cooking or at the point of consumption in the form of stable salts. Salt intake can be reduced by limiting the amount of salt and high sodium condiments like soy sauce, fish sauce when cooking and preparing food, or not having salt or high sodium sauces on the tables. Limiting the consumption of salty snacks, choosing the products with lower sodium content, and checking the nutrition labels to see how much sodium is in the product before consuming it. In other words, we can also use potassium to mitigate the negative effect of elevated consumption of sodium on blood pressure. So, the intake of potassium can be increased
yeah.
by consuming fresh fruits and vegetables.
That's great. The with the base of healthy diet, can you suggest some recommendation how to promote a healthy diet?
Promoting healthy diet includes public-private partnership and is multi-sectorial involvement of multiple sectors and stakeholders, including the government, the public, and private sectors. So the role of federal government is
Yeah,
very essential in creating a healthy food environment that enables the people to adopt and maintain healthy dietary practices. Policymakers'
yeah,
role are very essential as well to create a healthy food environment. And they can be in the form of incentives for producers and retailers to grow, use, and sell fresh fruits and vegetables, and reducing the incentives for the food industry so that production of processed foods having high level of saturated fats, trans fats, free sugars, and salts are decreased. Implementing the WHO recommendations on the marketing of foods and non-alcoholic beverages to the children, and establishing some kind of standards of healthy dietary practices in preschools, schools, and other public and private workplaces, institutions, and encouraging healthy diet habits. Also, making some kind of development of school policies and programs for the children to adopt and maintain a healthy diet, educating children, adults, and adults about the nutrition. For example, we had the practice of an apple a day keeps the doctor away. Encouraging culinary skills
that's
for the
wonderful.
children. Yeah, so many,
Yeah,
many policies and practices to promote the dietary habit and baby friendly hospital initiatives, promoting, protecting, and supporting breastfeeding in health services and community. And also, WHO has done a lot of work on this aspect, global strategy on diet, physical activity, and health by WHO in 2004.
yeah,
In 2010, recommendation on the marketing of foods and non-alcoholic beverages to children. And in 2012, comprehensive implementation plan on maternal, infant, and young child nutrition, and about the six global nutrition targets to be achieved by 2025, including reduction of stunting, wasting, and overweight in child, or improving the breastfeeding and the reduction of anemia and low birth weight. So these are some of the recommendations and policies which can help. So at the end, bottom line, more fibers, more vegetables, fruits, as we said, at least 400 grams per day or five portions of fruits and vegetables. So these are very essential. We forget about vitamins and minerals. We forget about refuges. We forget about of adequate amount of water as well as a part of balanced diet.
yeah, definitely. Yeah. So yeah, that's wonderful. And like you have all talked about like how we can stay healthy by eating healthy diets. And I would suggest all the audience to eat healthy and keep smiling. And see you in the next videos. Thank you so much for seeing this video. And thank you so much, Doctor.
Thank you very much.